Hey everybody, it's Jeff here once again at T-Werx, and welcome to our Community-Werx, C-Werx program. And I have the joy today of being here with my very, very close friend Erika Pratt of Samaritan Health. She is one of my favorite people, one of the most dedicated people I know that does what she does. And really I want to be able to share her story a little bit with you and the wonderful organization that she's part of that helps so many people here directly in our community, and you probably don't even know they exist in a lot of cases. So we're trying to help make that happen.
Thank you.
So Erika, tell us a little bit about, first off, how you got involved with Samaritan.
Okay, well, I have worked in basically healthcare administration my career.
Okay.
I started working at hospitals and then went to work for Lone Star Circle of Care, which is a nonprofit that offers health care to the uninsured and the underserved. And almost 7 years ago, the executive director position at Samaritan Health Ministries opened up, and it's where I live. I mean, I'm from here. I live in Leander. This was a way to, use my gifts and my skills
and give back to your community. Yeah, that's awesome.
Yeah, and so I had multiple people reach out to me to let me know that position was available, and almost 7 years later, here I am.
You're still there and still going strong.
Right, building it, really bigger and bigger because the need has grown, more and more.
Yeah,
since
as
the
the
day I
community
started.
grows. Yeah, I mean that's the thing. It's the community has been growing like crazy, and so the needs keep getting higher and higher.
Right.
Tell me a little bit about, or tell the crowd a little bit about what Samaritan is and how does it work.
Oh, absolutely. So Samaritan Health Ministries is a clinic for the uninsured, and so no form of health insurance at all, and no dental insurance. And so we provide primary medical care, so just like you would go to see your doctor if you had high blood pressure or high cholesterol, patients are coming to see us to do the same thing. Women's health care, so your annual pap smears, your mammograms, they come to us for those needs as well. And we also have mental health services, which most people know these days that's a much needed resource for folks as well. And we also have a dental clinic.
A beautiful dental clinic.
We do have a beautiful dental clinic. We're very proud of it. And we also have a pharmacy.
Okay.
So inside of our pharmacy, we are able to provide medications to our patients at no cost to the patient, as long as we have it there in our pharmacy. And so, and our pharmacy is only for our medical and dental patients.
Okay.
So someone from, like, you couldn't come in with a
from the
prescription
outside, you'd have
and
to,
get it filled at our pharmacy like you could at H-E-B or Walmart or
Okay.
someplace like that. But our pharmacy is licensed by the State Board of Pharmacy, but it is for our patients only.
Yeah. So how does funding work for Samaritan?
We work really hard. And so, in fact, I was just talking to someone today, and she said, "Oh, you get government funding." And I said, "No, we don't." She's like, "How do you make that work?" And I said, "That's a great question. We work really hard. The majority of our funding is through grants."
Okay.
And I, along as well as one of our board members, he's actually our current board chair, helps me with the grant writing. And then I handle the grant reporting. So we're very grateful for those foundations that are willing to work with us and to support what we do. And then we also do fundraising. And so, and I've hit you up before.
I know you
and
have.
So many of our friends for a great cause. But we do fundraising, and we do fundraising events to also, and we take personal donations, and there are multiple churches that are also kind enough, and organizations that are kind enough to support.
That's awesome.
The work
You've got a
that
big
we do.
event coming up here pretty quick.
We do. So on April the 28th, we have the Lanes for Lives bowling event that started with the Leadership Cedar Park class last year, and a lot of them are returning to put it on again for us this year. And events like that, we need volunteers. We need folks that are willing to help us. We need we still need sponsors, for that event, and it's a great opportunity to get your business name out to the community, as well as help us help other people.
Yeah.
right?
Exactly. Oh yeah, that's, I think more than anything, it's to help the end folks.
And you know, we're really passionate about what we do because we save lives. You know, and frankly, right? Because I sometimes I kind of hold back because I think, oh, I don't want to be so dramatic, or but we save lives. Yeah, frankly, and
that's a good job to have.
It is, and you know, when you think about the people that we serve and what resources are available to them, if we didn't exist, that scares me. Yeah, and we've talked a lot about, you know, with affordable care, you know, the Affordable Care Act. With
Unaffordable Care
Act.
Right.
And, you know, Obamacare and all of those different things. You know, many people are like, oh, well, what are you going to do? You're going to go out of business. I said, the day that I can close the doors to the clinic
will be the best day ever. Yeah.
I'm not even kidding. I will gladly close the door.
Yeah.
If all of the people in this area who need access to quality medical and dental care, if they can have that, and we're not needed, fantastic. I'll go do something else.
Yeah,
I'll go help.
I'm sure plenty of other people.
Certain there's another cause that needs somebody,
needs
right?
a champion. Yeah,
do you know what I mean?
Oh yeah, I know exactly.
And so you know, we've got people with diabetes. You know, if you don't get your blood pressure, you know, not your blood pressure, but your
A1C.
Yes, and see the doctor, go to the lab. You don't have your medication, you won't live.
Yeah.
You know, you can go blind. You can lose a leg, a foot, an arm. I mean, that's a real thing.
Yeah.
And so, you know, when people are making an investment in an organization like ours, like Samaritan Health Ministries, you're helping us keep these people healthy where they can still go to work and still be productive and still contribute and to the economy, versus waiting until it's so bad that then they're disabled. Yeah. And they can't work.
Yeah, and then they end up in the emergency rooms.
And that's not what they want either. No. And everyone knows that the emergency room's not really where they go to get that kind of care. That's not what the emergency rooms are meant for.
It's there for, okay, now I do have a major issue and I've got to get taken care of.
And again, the cost, you know, I think this is talked about often, the cost of seeing the patient in the emergency room versus the cost of seeing the patient in our clinic is dramatically reduced. Yeah. Right, absolutely. And for those who don't know, at Samaritan Health Ministries, we're staffed with, we do have paid staff, but frankly, it started as an all-volunteer organization. Every single person in the organization.
Including the doctors.
Everybody. Yeah. Every last person that was there, yes, including the physicians, were volunteers. Yeah. But then as the organization grew, and then you get grant funding, there's more to manage, so it's more so that you end up having to have paid folks that you can count on, you know, consistently to be there. So we always
those critical positions that you have to have.
Yes, I can't have. Right, and you know, so we say that our model is we're volunteer based and staff supplemented. Sure. And so, you know, for example, our pharmacy, all of the pharmacists that work in our pharmacy are volunteers. I don't have one paid person in the pharmacy, even the pharmacist in charge. So, you know, it's our psychiatrists in our mental health.
Volunteers.
All volunteers. The counselors, they're all volunteers. We have volunteer dentists, physicians, nurses, front desk, you kind of name it. Yeah. We're really fortunate to have people who, I mean, like I tell them, you could do anything with your time. Yeah. And we're honored.
Why not use the skill set that you have to...
And then we're honored that they would choose us.
Sure.
To spend that time that they could be doing anything else.
Absolutely.
And you know, I think one of our pharmacists, for example, he comes in several times a week, and you know, I was telling him, thank you so much. I really appreciate that you do this for us. And he turned around to me and he said, well, thank you because you give me purpose. Right? Yeah. I never thought about it that way. Yeah. And so, yes, we're an organization that, you know, provides healthcare, medical, mental health, and dental care to low-income, uninsured folks in our community. But we're also an organization where you can use your gifts and your talents to give back. Yeah. to other people.
Yeah,
And we don't ever want to lose that.
yeah, and feel good about
Mm-hmm.
I'm doing that. You know, it's this is something I'm using my talent for good.
Mm-hmm.
You know, beyond just making money, I'm doing this because it's me.
Right.
That's who I am. That's phenomenal.
Yeah,
So what are
absolutely.
some challenges that you have? You know?
Our biggest challenge at the moment, frankly, is space.
Okay.
It's space.
Mhm.
We're literally in a triple wide portable trailer.
Yep.
You've been there.
I've
You
been
know
there.
the deal.
Yep.
But we use, as you know, every inch of that space. I'll bring anyone out that wants to look at it. If they've got any
If you
more
could find
efficient way.
any more ways.
You know, we try our best to do what we can,
Mhm.
you know, in the space that we have. And we've expanded hours and
Mhm.
days and all of that. And we're really coming to the point now that if we are going to continue to meet the needs of the folks in this area,
Mhm.
we're going to have a bigger space because we need more exam rooms so
Okay.
that we can have more
Yeah.
doctors and nurse practitioners
Okay.
there at the same time.
Okay.
Yeah, so that's our biggest challenge at the moment. You know, every nonprofit's going to say we need money.
Yeah.
So
It's a given.
I
Yeah.
have to say it, right? It's a given because
Yeah.
that's what pays for medication and
Mhm.
the lab work. You know, for our patients as well, I didn't mention this, but the clinic is not actually free. So the patients do go through a financial screening
Mhm.
the first time they come in and annually.
Okay.
And so we want to find out if they qualify for another program.
Mhm.
Because if they qualify for another program, we want to get them in the other program
Sure.
so that our resources are only for those people who have
Yeah.
no other option.
No other. Yeah.
They've
There's
got
nothing
nothing,
else. Yeah.
right?
Mhm.
And we don't have the extra space to take on extra people or the extra resources.
Yeah. We don't make any more money by having people.
No,
come
the more
in.
patients we see, the more money we
Yeah.
lose.
Yeah. Exactly.
But we see all that we can.
Mhm.
We do. We
Yeah.
really do. And so if they qualify, maybe they qualify for Medicaid.
Mhm.
I didn't know.
Yeah.
Or the Wilco, the Williamson County, the indigent program,
Mhm.
but they didn't know.
Yeah.
So we use our own resources to screen them, see if they qualify.
Get them
If so,
where they
let's
need to be.
move
and,
them, move them
Yeah.
along. And then for those who stay as a patient of ours, they do pay a small copay based on their income
Okay.
and their family size.
Got
So
it.
we have 4 scales, sliding fee scale, A, B, C, and D.
Okay.
And they pay $10, $20, $30, or $40 per
Okay.
visit. So majority of our patients are scale A,
Mhm.
so they pay $10.
Okay.
And that $10 is if you come in and you see the doctor
Mhm.
or the nurse practitioner, you pay $10 for that visit.
Okay.
If they order lab work, we pay for that on your behalf.
Mhm.
So it's free to the patient. If you need medication, if it's medication from our in-house pharmacy,
Mhm.
we provide that to the patient at no cost. We pay for that
That's awesome.
on our own. And so it's not free,
Mhm.
but we feel like it's very
It's-
affordable.
Yeah, it's within
And-
reason and
But I also feel, for someone, then maybe they don't feel like it's such a handout.
yeah,
That your copay was $10
Mhm.
and you paid $10 and that's
that's you
what
put
it
in your
was.
part. Yeah.
Yes.
Yeah, you put
And that
in your
they have
part.
some responsibility and accountability too for their health care,
Mhm.
because it's not just about us prescribing medication. They have to want to be healthy
Yeah.
too, and sometimes that means changing their lifestyle and how they eat,
And a lot of people,
exercising.
and a lot of people, if there's any value, or if there's no cost, then there's no value.
Right.
People don't see the value of that, and
Right,
so
absolutely.
I think that's wonderful.
And one of the big things that we do as well, I talked about our pharmacy,
Mhm.
and we also work with the drug companies.
Okay.
So there's a prescription assistance program that
Mhm.
the drug companies offer for patients who financially qualify,
Okay.
which are our patients, that there are particular brand name drugs that those patients can get at no cost.
Hmm.
And so I employ a part-time medical assistant who actually handles the application process. So the patient comes in, sees the doctor, provides their financial documentation, signs the application. We do everything else.
Mhm.
The medication gets sent to our clinic. They come to pick it up, and it's at no cost.
Yeah, that's awesome.
So things like insulin
Mhm.
that are hundreds of dollars a month,
Yeah.
which frankly, we couldn't afford to keep in our pharmacy.
Yeah, 'cause
we're
it's-
able to get from the drug companies at no cost.
That is
And
awesome.
so last year, it was probably about $600,000 worth of brand name drugs that we received for our patients at no cost.
Yeah. That's the part of the drug companies that you don't hear.
It is.
You know, you hear so much,
It
oh,
is.
the evil drug companies. Well, they do some nice things too.
They do. And, you know, another example of a drug would be for hepatitis C. So
That
most
is
primary care clinics,
realistically expensive.
yes, most
yeah.
primary care clinics do not treat hepatitis C. We're fortunate to have a relationship with a doctor in Austin that was
Okay.
willing to train our providers because we had a handful of patients that were hepatitis C that referring to a specialist is really not an option because they can't afford it.
Yeah.
And so one of our nurse practitioners was determined that she was going to find a way to treat them and approach this physician, and he was willing to help us. And now we have cured multiple patients of hepatitis C.
Who would have never had that opportunity.
No, and
Yeah.
the drug is almost $100,000.
Ooh,
But we get it free.
free from the drug company. Yep.
So I think it's just another example too. I hope people can see that, you know, we work hard. We try to use every resource that is available
the
to us.
scrappiest and most resourceful people on the
We
planet.
try.
Yeah.
So that when you do give to us, whether that
Yeah.
be monetarily or, you know, with your time, which is valuable, you know, to you as well, that you know that we're using it the best way that
Absolutely.
we can.
Absolutely. Well, is there any other message you'd like to give to the audience of just how they can help?
Absolutely. I think, you know, I would just like to say, find your passion. You know, if it's not Samaritan Health Ministries, frankly, that's okay. You know, if it's not healthcare, if it's kids or dogs or, you know, whatever it might be, I would say find your passion and give back just a little. And, you know, maybe if you have time and you don't have the financial resources, then volunteer a few hours a month somewhere if you can. If you don't have the time but maybe have the financial resources, then maybe donate to one of us. I'd love for it to be us, but I get it.
Yeah.
You know, all of us,
It's what it
we're
is,
all
yeah.
in the same boat. We all need
Yeah.
people and money.
It's
Frankly, and so, but find something that means something to you in some way, and give a little, and you'll get back. I really promise you'll get back way more than you've given.
Yeah.
I feel sure.
Now, do y'all coordinate with some of the other organizations here in town, like with like Reveal Resource Center and stuff like that?
Yes. So
Okay.
many times, you know, Hill Country Ministries or Reveal Resource. In fact, I've just been in touch with them this week.
Okay.
Because I needed some boost or insure for a patient that couldn't afford it, and
Okay.
they helped me out.
Yep.
So thank you. And so we oftentimes have the same clients
Yeah,
or patients.
that's what I was thinking. I mean, they're all
So we
similar,
send
yeah.
patients to them when they need food resources, and those organizations, you know, when they're finding out that they need food, oftentimes find out that they also need medical assistance and send those patients
Yeah.
to us as well. And we work with many other organizations in the community too. The churches know that we exist so that they can send folks over
Yeah.
in our direction. So if you know you're uninsured and you know you meet our income requirements, then we are happy to take care of you. And most of our volume is chronic disease management. And that means it's a serious thing.
Yeah.
It's not just coming in for allergies. Not that can't be serious, but
yeah, it's major issues that need to be addressed.
and major
And managed.
multiple
Yeah.
issues that have to be managed on a regular basis. Absolutely.
That is fantastic.
So,
Well, thank you for everything you do for our community.
and same to you.
Thank you. Well,
Thanks for
this is
doing
what we
this.
do.
We appreciate it.
But folks, I can't tell you if there is anybody. I basically she can ask anything of me and I will do it, and she knows that. But
I do try to not ask much though because I don't know.
You when you share it when it's important. But I will tell you, if there is an organization here in this town that you really, if you have a passion for medical and making sure that we take care of the folks that really need it in our community, this is a wonderful place to volunteer. And it doesn't even have to be medical, that you can help
Front
maintain the
desk.
building.
Oh, that'd be great, by the way, because sometimes that's me.
Yeah. And has the deck been done yet, or no? Front deck?
Oh, it's been
Oh,
repainted,
okay.
yes.
Okay,
Mhm.
well, good. That was what we were going to do, and we never did, so
Yes.
sorry.
That's okay. That's
But
okay.
there's all kinds of ways that you can help, and just reach out to Erika. How do they get a hold of you?
Oh, you can call the clinic. That's 512-331-5828.
Okay.
Or check us out on our website. So that is www.theshm.org. So that's THESHM.org, or find us on Facebook.
Awesome. And right down below me is our subscription button, and right down below both of us will be our show notes page, and that's actually going to have all of that information that Erika just had. So if you want to help out, just reach out to Erika, and I'm sure she'll find something for you to do.
Absolutely. And too, even if you just want to find out more information, we're happy to bring people in just to see it. Just come for a tour and see what we're doing right here in Cedar Park, right here in our own community.
And if you need help, if you're listening out there and you need help, please
Let us
reach
know.
out.
We're happy to help you.
Glad to help you.
Absolutely.
So thanks, everybody. Well, we'll see you guys here next week. Once again, subscribe to the channel so you get to meet all these really cool people like this. And we will see you here next week.
Thank you.